According to the Centers for Disease, approximately 1 out of 3 Americans are sleep deprived. In fact, you or someone you know likely suffers from poor sleep habits or a sleep disorder. Poor sleeping habits and disorders like sleep apnea, insomnia, and restless leg syndrome directly impact our quality of living and overall health. With sleep centers across Long Island, the Catholic Health Sleep Medicine specialists are here to help you get the rest you need. On today's show, we'll hear from 2 Catholic Health sleep specialists about some issues that could be affecting you or your loved ones and the different treatment options available throughout our system. We'll also be joined by a patient who will share her experiences at Catholic Health Sleep Center and let you know what to expect. Welcome to Catholic Health Stronger Together with Dr. Dave. Sleep plays a vital role in your good health and well-being. The way you feel while you're awake depends in part on what happens while you're sleeping. To speak more about this is Brendan Duffy, Catholic Health Director of Sleep Services. Welcome, Brendan.
Thank you for having me.
What is the difference between a sleep disorder and what most people call a poor night's sleep?
A poor night's sleep is something that might be transient and then you get over it and you sleep a little better. But other people have consistently poor sleep, either because of a couple of issues such as quantity, not having enough time for sleep due to jobs or responsibilities, quality, where most of the sleep disorders fit in, or timing. Maybe shift work, they work opposite shifts and it impacts their sleep ability or how they are able to manage their sleep. So all of that considered is where you would look at sleep disorders.
For you, what are the most common disorders that you treat in your sleep center or Catholic Health Sleep Centers?
So in the sleep centers, usually it's sleep apnea, and that's pretty common in sleep centers. What we don't see enough is people that have complaints of insomnia because they may not show up at the lab saying they're not going to be able to help me because that's all they do. But there's about 85 different sleep disorders.
When do you say to somebody, you're just having a poor night's sleep versus, you may have a sleep disorder? Where do you draw the line?
Well, actually, when they come in, they have a very thorough investigation of their sleep habits, their health habits. Kind of a diary is also a helpful tool to see how are they managing their sleep. Are they giving it enough time? Because in this society, especially in the city that never sleeps, 6 hours is considered, oh, that's a good sleep. But actually, when they do tests, people that have 6 hours sleep perform the same on reaction tests as if you had 3 alcoholic beverages. So basically we're all out there driving, too many of us, with 6 hours sleep thinking we're fine, and we're really not. Just the same, somebody that had a couple of drinks thinks they're fine, but there's another level that we can be at, and it's healthier for us.
6 hours or less of sleep per night is equivalent to having 3 alcoholic beverages.
Correct. When they did research and reaction tests, and I speak to athletes, and that's what I tell them. They would never go out on the court like that purposely, but that's what we're doing to ourselves. There are very, very few people that can realistically manage at their best on 6 hours or less sleep. Most of us need somewhere between 7 and 9, and you'll know that you're there because you feel refreshed during the day. You can go about your daily business. You're not needing caffeine. You're not falling asleep during meetings. That's a sign to you that either you're not getting enough quantity of sleep or the quality of sleep, something's going on, and you shouldn't ignore the snore.
Don't ignore the snore.
Don't ignore the
That
snore.
sounds like a bumper sticker.
Yeah, it is.
When is it maybe we should look into it more?
Okay. So for sleep apnea especially, if somebody is saying that they have pauses in breathing, usually a spouse will out their partner and say, this person, they worry me, and they actually break up their sleep too, so we get 2 for the price of 1, is their sleep is altered because they're nervous about their partner. They're nervous because they stop breathing and then they start again, and that's a full-fledged apnea where there is no oxygen going to the brain and the heart. The brain has to acknowledge that the CO2 builds up, take a breath, snore, and then they start again. So the snoring, the pause in the breathing, morning headaches that kind of go away after an hour or two, because again, that's the brain and the lack of oxygen. So those are some of the signs that you're looking for. If you need stimulants during the day, as far as a lot of caffeine to get through the day, that's another sign. There is a dip during the afternoon, and that's a normal circadian dip where everybody thinks after lunch, I want to take a good nap, and that's natural. There is from about 1 to 3 or 2 to 4 in the afternoon, so you shouldn't worry about that. But the meetings is any quiet situation, or especially if you're driving, which unfortunately we've had people say at stoplights, they tend to doze off. Very serious warning signs, obviously, that they should get it checked out.
I hear this all the time. I think I have a problem with my heart because I'm tired between the hours of 2 and 5 o'clock. Tell us just a little bit more about that, because it's a very common feeling.
Right. There's two systems that go through the day that influence our sleep. And there's a homeostatic drive and a circadian drive. And the circadian drive goes up, goes down around lunchtime, and then you become more awake and alert towards the evening.
So circadian, just for the viewers, it's really our internal clock, biological clock? Okay.
Correct. And every cell has a clock, believe it or not. And just one night's sleep, even to the cellular level, can damage the DNA. Just one bad night's sleep. For our immunity, especially these days where we're talking flu and vaccines and different things, just one night's bad sleep can knock off natural killer cells by 75%.
Wow.
So these are cells that are programmed at night. One of the functions we have is to restore and replenish what we've damaged during the day. We don't give it an opportunity to function the way that it should. So really important for immunity as well as general health.
Wow, fascinating, absolutely fascinating. I think especially lately we are recognizing that, diet, exercise, and sleep are really the foundation of health.
And I would go one step further and say sleep has the hierarchy in that it is really the foundation, because when you think about diet and weight loss, our hormones are influenced by how much sleep we get. So if we don't get enough sleep, ghrelin, which says keep eating and you're hungry, it goes in one direction, and leptin, which tells you you're satiated, you're good to go, we lower that. So it's hard for somebody who's trying to diet to really achieve their goals if we don't talk about proper sleep to make that work correctly.
What are some of the treatment options we have for these people?
So for sleep apnea, the go-to and the gold standard is CPAP. And I know that a lot of people have struggled with it. I actually use CPAP myself. So in the beginning, I would say it is something you have to get used to, but it's become a lot easier, because the mask, which used to be all over and a big facial circumference, it's come out to be very little. It's actually cannulas, sort of like a nasal cannula, which you would wear with oxygen, except it's a bigger bore tubing and it goes under, so it's not covering the face anymore. The other improvements they really made is the machines themselves used to just generate whatever the highest pressure the person needed through the night to keep their airway pattern. Now it can go up and down as needed, so you're not uncomfortable at the times you really didn't need that high pressure. So there are now auto CPAP machines that can go up and down, and they're a lot more comfort and patient friendly. So that is that. If a person cannot get used to that, or even before they try it now, if they have mild, moderate apnea, they can try an oral appliance that a dentist could make. And it does basically what CPR does. It pulls the jaw forward to open that airway. We also have Inspire, which some people are now experiencing getting Inspire devices. And they are implants which go under the collarbone, and there's wiring through, and it pulses the tongue to keep that tongue forward. So those are just a couple. Some people coming in with insomnia. Cognitive behavior is very effective, more effective than the sleeping pills, and probably a better thing to look at. So different methods like that.
Wow, it's amazing. I didn't even realize we had so many options for people. Yeah. That's fantastic. So just CPAP is continuous positive airway pressure?
Continuous positive air pressure.
Okay.
And what it does, it splints the airway, so when your airway goes to collapse, because when you go to sleep, everything relaxes, muscle tone goes off, especially when we go into REM, when we dream, so that we don't act out what we're dreaming about. There's a further fall off of that muscle tone. The auto CPAP will build up and see that is starting to collapse, and it will produce enough pressure to keep that airway pattern so you can breathe in and out comfortably.
Wow, it's amazing. And the devices are not these Darth Vader masks any longer that people fear, but these small nasal cannulas are smaller.
They are,
masks.
And they even have traveling machines. I have one for traveling to make it easier so you don't have to carry that extra backpack. The travel machine is no bigger than the palm of my hand that I use, so it's incredible what they've done. And the future is really almost here, where in 3 years, I'm speaking to a doctor now saying that they're working on a sleep apnea pill, and there are at least 3 other companies pursuing the same thing. Our labs are all hotel-like, so they're not a normal hospital bedroom. If you go in there, you'll see that it has a big queen-size bed, and it looks very nice. And so we try to make it in a relaxing environment. The staff is well-trained. They're all licensed technologists, and they've seen enough, and they understand that ambivalence with the patients, so they make them very comfortable and answer all their questions.
What percentage, roughly, would you say of people cannot stay the night and sleep?
It's got to be less than 5%.
Okay, gotcha. So the vast majority have no problem.
They do, and we get a good diagnosis on them, and then we can move them on into treatment and improve their quality of life. So it's very satisfying for the techs. We see people that coming in, and they'll say that they're engaged with their families now, with their spouses, with their kids. They're able to go to activities that they just didn't have the energy for. So their whole quality of life, blood pressures, medicines maybe are reduced because now they're in charge of their blood pressure a little better.
Wow. And how about the home sleep tests? Can you just briefly speak about that?
Special category for home sleep. It has the advantages would be that you can do it at home, so you could do it on your own time in your own bed. So that's definitely an advantage. It's probably quicker because we do have a limited number of rooms in the sleep centers. Now sometimes the insurances, they force to go that way, and we'll work with it. If it doesn't come out that we get a valid test or we don't have information, then we will ask them, and they'll usually let them come in the lab.
How can patients find you and your center or a Catholic Health Sleep Center?
They could just call the number, my LI Doc, which is one way. I'm working out of St. Charles, but we have sleep centers at St. Joseph's, Mercy, Good Sam. We actually have a pediatric center at Good Sam, which is very important because pediatric sleep issues are a big thing. St. Catherine's and St. Charles. If they want to call me, I'm happy to answer any general or sleep questions at any time.
That's fantastic. Well, so there's no excuse. We got a sleep center near you.
Yes.
Right.
Yeah,
okay.
We do.
Brendan, thanks so much for taking time out of your busy schedule.
My pleasure, thank you.
We have to take a short break, but when we come back, we will continue our talk about sleep apnea.
Food. It nourishes, brings us together, and adds flavor to life. That's why it's important to wash hands, surfaces, and fresh produce. Keep raw meat, poultry, and seafood separate from ready-to-eat foods like fruits and vegetables. And cook to proper temperatures using a food thermometer. Enjoy, and refrigerate leftovers within 2 hours. For more tips on safely preparing foods, visit homefoodsafety.org.
You can't text and pay attention to the world around you, and you definitely can't text and drive. Every year, deaths due to distracted and negligent driving are increasing. In fact, while drunk driving rates have dropped greatly, negligent driving fatalities have skyrocketed. Find out more at negligentdriving.com.
Are you ready to open your heart and home for 18 months to a puppy like Esther? To find out more about becoming a canine companion for Independence Puppy Raiser, visit cci.org or call 1-800-572-BARK. You can make a world of difference in the life of a person with a disability.
Do you or somebody you know have trouble sleeping? According to the National Sleep Foundation, 1 in 3 individuals suffers from insomnia. I'm here with Dr. Marta Maczaj, St. Charles Hospital's sleep medicine specialist. Marta, you're here. We need you, okay? A lot of people watching this have difficulty sleeping. We throw the word insomnia around. So can you give us some clarification as what is insomnia and how do you approach a patient who is having difficulty sleeping?
Very, very important topic. Insomnia is actually the most common sleep disorder. And as you mentioned, 1 in 3 Americans suffer from it at some point in their life. Insomnia basically is defined by the inability to fall asleep, having difficulty falling asleep, the inability to maintain sleep or having frequent awakenings during the night, or waking up too early in the morning and not being able to get back to sleep, or sleeping an adequate amount of time but feeling not rested and not refreshed upon awakening. And insomnia has many, many different causes and is important. It's important when somebody presents to us complaining of difficulty sleeping or insomnia. it's important for us to tease out what might be contributing to it. We all know that at some point or another before a stressful event, so for example, we're both physicians, so our patients before a procedure, if they're hospitalized, they may have difficulty sleeping because they have anticipatory anxiety, they're worried about what's going to happen. So that's they'll have difficulty falling asleep, but that's very temporary. Other individuals have chronic insomnia, where they for months, for 3 months, 4 months, 6 months, years sometimes, have difficulty sleeping. And for those individuals, there may be more complicated causes. So for example, individuals who can't sleep may have ongoing psychosocial stressors. They may be suffering from a divorce or chronic illness, or they may have other issues that are psychologically difficult for them. They may have medications that contribute to their not being able to sleep at night. For example, asthma medications, inhalers can cause insomnia. Beta blockers can cause insomnia.
Yeah, sure.
As a cardiologist, no. Also, certain medical conditions, congestive heart failure is associated classically with insomnia. Individuals who have underlying lung disease, COPD, complain of insomnia. And then people with, for example, hyperthyroidism complain of insomnia. In addition to this, there are psychological or mental health disorders which are classically associated with difficulty sleeping, and those include depression. And for depression, the main complaint, it could be either initial maintenance or terminal insomnia, waking up late, very early in the morning. But the main complaint in depression is waking up too early and not being able to get back to sleep. So waking up 3, 4 o'clock in the morning. Anxiety disorders, also very common affliction in our society, especially after the pandemic. The rates of anxiety disorders has really skyrocketed. Anxiety disorders cause frequent awakenings during the course of the night. And then I have to remember to include sleep disorders. So there are individuals who have untreated, undiagnosed sleep disorders such as sleep apnea, which can cause maintenance insomnia, non-refreshing sleep, even if they sleep for 8 hours or 10 hours, and individuals who have restless legs or who have periodic limb movements. These little twitches of the legs can fragment sleep and cause non-restorative sleep, so the person may be sleeping, not aware that they're kicking, but have the non-restorative sleep.
You know, we all know somebody who is just not a quote-unquote good sleeper. You know, we've heard that over and over in our lifetime. So it's really more than that. Before we label somebody not a good sleeper, we really should meet with a sleep medicine specialist and try to unpackage some of this and come up with maybe a solution. It could be life-changing.
It could, definitely. Not sleeping well raises your risk for immune problems. It raises your risk for other illnesses. And it also raises your risk for cognitive decline. So it's very, very important to address insomnia.
You don't need to snore, and you could be thin and still have sleep apnea.
That's true.
So that leads me to the next question. Who gets screened for sleep apnea?
Well, the first thing that's very important is if you snore. You know, you could be a woman, you could be a child, you could be an older individual, you could be thin, you could be overweight, you could be obese. If you snore, that is not normal, and you should be evaluated.
Snoring is never normal?
Snoring is not normal. It's a sign of upper airway obstruction.
Interesting.
It doesn't necessarily mean you have sleep apnea, but it's not normal.
Okay.
It's a red flag for us.
Right.
If on top of the snoring you have fatigue, let's say you're sleeping 7 or 8 hours, so you have a good amount of total sleep time, but you're waking up tired, that's not normal. If you're falling asleep when you're inactive, so you're watching TV at 7 o'clock in the evening, you put your feet up and now you're falling asleep, that's not normal. You're falling asleep in meetings, not normal.
Wow.
So daytime sleepiness is a symptom that goes along with sleep apnea. So if you have unrefreshing sleep, if you have daytime sleepiness, if you're snoring, if your bed partner is telling you you're not breathing right, or you're struggling, or you're making funny sounds while you're sleeping, that's a sign. Or if you're waking up gasping and choking, which rarely, happens to people who have sleep apnea. They don't know they're doing anything at night.
Right.
They don't think they snore even.
Right.
But if you ever wake up gasping or choking, that's a big sign.
Wow.
So if you're tired and you have a good amount of sleep, if anyone's ever told you have a narrow jaw structure, you had to have teeth pulled, you had to have braces as a kid, those are all signs for us that you may have sleep apnea.
And the other thing you're teaching us is that, we see ads all the time, dental appliance. Are you tired? Try out dental appliance. It's really not that easy. You really need to have a formal workup by a qualified sleep medicine specialists.
That's correct. You
Yeah.
need to know what you're
You
treating.
need to know what you're treating before
exactly.
you can treat anything.
And how
Gotcha.
severe it is or how
Right.
mild it is.
Right, that's very, very important. So what happens if sleep apnea is untreated? What are some of the consequences?
So there could be very serious consequences, and they're primarily cardiovascular. So when a person has the untreated sleep apnea, what's happening is at night they're holding their breath, they're having shallow breathing, and the oxygen is dropping. So at night, a person is supposed to breathe normally, readily, steadily, and their heart rate is supposed to be slower and steady. Their blood pressure is supposed to be lower and steady. When a person has the sleep apnea with that irregular breathing and the oxygen drops, the body goes into like a conservation mode when they're not getting enough air and not getting enough oxygen. So everything slows down, the heart rate slows down, the blood pressure drops, and then the oxygen drops too low. The brain sends a sympathetic discharge, so like a little adrenaline surge to wake up and take a couple of good breaths. And at that point, the heart rate speeds up, the blood pressure shoots up so that the person can have a little arousal to breathe well. And consequently, instead of spending 7 or 8 hours in bed with a relaxed nervous system, a lower heart rate, a lower blood pressure, the person is having these huge blood pressure and heart rate swings up and down throughout the entire night. So consequently, the heart is stressed. The person has a higher risk of having high blood pressure because the blood pressure is not relaxed and low
right.
for those 7-8 hours. So increased risk of high blood pressure for people with untreated sleep apnea. Increased risk of cardiac arrhythmias, both the slow arrhythmias and the fast arrhythmias. And one of the most common cardiac arrhythmias that are associated with untreated sleep apnea is atrial fibrillation. The other thing is that it increases your risk of a heart attack and a stroke. You have to think again what's happening cardiovascularly, physiologically with these swings. And when a person's blood pressure spikes, that can raise your risk of a stroke.
Yeah.
And then when the oxygen is dropping, sometimes the oxygen drops very low. And with that, you have to think about what's going on with the coronary artery circulation, with the circulation in the heart. Those arteries that are feeding the heart are not getting enough oxygen.
Yeah.
So they're stressing the heart muscle. So increased risk of heart attack, increased risk of stroke, increased risk of high blood pressure, so cardiovascular and arrhythmias. The other thing that we now know is that it affects your cognition. So untreated sleep apnea is associated with a higher risk of dementia. It's not going to happen in a year or two, but down the road with years and years or decades of untreated sleep apnea.
I want to thank you for taking the time out of your very busy schedule to be here with us. We have to take a short break. When we come back, we will hear from a patient who will share her experience at one of our Catholic Health sleep centers.
Okay, so we drowned the fire, stirred it, drowned it again, and now just feel if it's cold.
Yeah.
Cool.
Smokey just gave me a bear hug.
I know. Already posted it.
Discover immunotherapy and find out how your body's natural immune system can become your greatest hope in the fight against cancer. Speak with your doctor and visit su2c.org/immunotherapy to learn more.
Welcome back to Catholic Health Stronger Together with Dr. Dave. Catholic Health offers patients a comfortable setting in hotel-style sleep rooms. Certified technologists monitor a patient's sleep during their overnight stay. Joining us now is Cathryn Byrnes, Catholic Health's sleep center patient treated for sleep apnea. Welcome, Cathryn, and thank you for joining us today.
Thank you, Dr. Dave.
How did you know you had an issue with sleep apnea?
I really didn't know that I had an issue with sleep apnea. I mean, I was very tired, and it's like I realized I wasn't sleeping right, but I had worries. I also have inflammatory arthritis, and a lot of that is exhaustion is typical with that. But it got to the point where I just wasn't sleeping at all. And my cardiologist recommended that I go for a sleep study. And I kept putting it off, and I kept saying I didn't want to go to the hospital during COVID. I didn't want to go for the sleep study. I didn't want to sleep with a CPAP machine. So when they finally did test me, my numbers were bad.
What was the reality of this study?
I was actually very intimidated. The first study I actually did at home. They sent me a kit, and then I had to send it back. And that was the first results. The second study I had in Good Sam Sleep Center.
Mm-hmm.
And I was really intimidated. I didn't want to go in there. I didn't want to sleep there. But I actually found that I slept. And the weird thing is, even though I think they did use a little bit of O2 on me when I was in there, is that I actually got like 3 or 4 hours worth of sleep. But it actually was good quality sleep. They fitted me with the machine. Once I started using it and I got accustomed to it, I found that when I used it, I would sleep for longer periods of time. I wouldn't be waking up gasping for air in the middle of the night.
Your preconceived notions of, this horrendous test that there was nowhere you were going to sleep, and even if you did have the diagnosis, the machine they were going to hook you up to was not going to fit well with your lifestyle. All of that was not what you thought it would be.
No.
It was a lot easier.
It's a teeny, tiny little machine they give you now. It's about this big by this big. Mm-hmm. It comes with a cute little carrying case.
Okay.
And the mask is small. You can get an assortment of fittings. I have no problem sleeping with it at all. And then I've found that once I started making sure that I'm using it every night, it didn't happen right away, but I found that I started sleeping longer and longer. And then I started feeling better. I wasn't as exhausted in the morning. I wasn't, it was like I started to physically feel better. It's like I had a great blood pressure check. My blood pressure went down. Some of the swelling that I had went down because I was spending a lot of continuous time with my feet up. So a lot of good things came out of it.
It's amazing that you probably lived a very long time with this condition, not knowing, and you're having all these other maybe related issues, not knowing that it could have been stemming from sleep apnea.
Yeah.
Let's go back before you were diagnosed. How long did it take after starting the mask, to wear the mask, did you notice that these changes were happening?
Maybe about 3 months.
So you have to be patient. It's not going to happen overnight.
No, it's not going to happen overnight.
Right.
It's not medication. It's not a procedure. It's a piece of equipment.
Right.
It's a little tiny mask, and if you could just use that at night, that's a big trade-off for the benefits that you get.
I'm very appreciative of your time, and thank you for coming in today and sharing your very important message with the audience. For more health information, tune into Catholic Health Stronger Together with Dr. Dave. If you would like to know more about Catholic Health Sleep Centers, or to make a gift in support of this or another program that is important to you, please visit chsli.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. Dave Degatti, and I hope to see you next time on Catholic Health Stronger Together with Dr. Dave.